Protect, detect, report. They're powerful words. Nobody chooses to be a victim, but every day people like you and I are targeted by savvy crooks looking to rip you off or steal money from the healthcare system. We all think we're smart enough to keep from getting scammed. That only happens to other people, right? Wrong. From the well-dressed door-to-door salesman to the kind telemarketer, there are a lot of really smart, really unscrupulous people out there who spend their days figuring out just how they're going to con you out of your life savings or rip off the Medicare or Medicaid systems. But you have the power to make a difference. I'm going to introduce you to real people who've taken the words protect, detect, report to heart. They've protected their Medicare number and other personal information, detected scams, and most important, reported errors and fraud. Rosella Boyce got a suspicious phone call one day. Fortunately, she knew how important it was to protect her identity.
The phone call simply said that the war had caused $64 million deficit. And as a result of that, the money for Medi-Cal was being withdrawn to take care of the war. So I, of course, was angry and said a few quick things, and he said to me, "Oh, no, you don't understand. That is why we are here. They're going to use the Medi-Cal money, but Medicare has already set something in place, but we must issue you a new card." Then he proceeded to say, "Now there are 11 numbers at the bottom of your checkbooks. Please read those numbers to me." And I said, "I beg your pardon, you read those numbers to me." And I said, "Why do you need access to my checking account in order to send me the new Medicare card?"
Rosella did a lot of things right. First, she wrote down as many details as she could remember from the call. She checked her caller ID and asked for the caller's name and the name of his company. And most important, she simply hung up the phone on the caller. It's okay to be abrupt with callers or just hang up if being polite doesn't work. Next, she told everyone who would listen about the call. She didn't want others to be victims of the scam.
The first person I called was the police department. They gave me another number to call that was associated with Medicare. And then they gave me another number that was out of the city, in the Bay Area. And when I finished speaking to them, they asked me if I would speak to someone in Washington. And I did that. I called all my friends and told them everything that went on.
Now meet June Richardson, better known as the Scamgram. June has been tireless in her efforts to help senior citizens avoid being victims of fraud. In more than 5 years of working and volunteering with her local SMP, she has submitted more complaints to be investigated than any other volunteer in her state.
This is June. How can I help you?
I was working at the office, and a couple came to me and said they thought that they were in trouble. And upon talking to them, I found out that they had been invited by a printed invitation to a supper at a local restaurant. When they got there, a man provided their meal for them, but he also was selling magnetic mattress pads. And they paid for it, and with quite a large sum of money. But after they got home, they got to thinking about it, and they decided they really shouldn't have spent that much money for that. They probably didn't need it. And it was a long, drawn-out affair. They tried to contact the salesman. They got no answers. The answering machine would take their message, but he never returned their calls. Eventually, the Attorney General's office took and investigated it. And the last I heard, they were still waiting to hear what the results were. But they were being investigated and prevented from selling in some areas.
Many similar cases have been reported involving all kinds of medical equipment, wheelchairs, back braces, diabetic supplies, and the like. If Medicare covers the cost of a piece of equipment you've been pushed into buying, one that doesn't fit or really isn't right for you, they aren't going to cover it a second time. That means that if you need that wheelchair or back brace later, Medicare won't pay for it. So detecting this kind of fraud is important to both you and Medicare. And while June is proud of the work she's done helping others, she's just as proud of detecting a $20 error on her own Medicare statement.
I had had total knee replacement, and upon reading my Medicare statement, I discovered I had been charged and Medicare had paid for a Pap test. And so I called the clinic, and they said, well, I must have had it. And I said, no, I did not. So then eventually I called Medicare, and the clinic had to return the money to Medicare that had been paid them. And while it wasn't a large amount, if it's duplicated very many times, it's a drain on Medicare.
Detecting what Medicare is paying is as easy as looking at your health care statements each month, including the ones from Medicare that say, "This is not a bill." Since the statements may not arrive until months later, it's up to you to keep track of your health care. It's easiest if you keep a personal health care journal. Each time you see a doctor, get a prescription filled, have a test, or go to the hospital, write the information down, including the date, the time, and who you saw. All the things that Medicare is paying on your behalf are itemized on your statement. Medicare also offers you an online version of your statements that you can look at anytime, night or day. It's called mymedicare.gov. If you go online, you don't have to wait months to find out what was billed or paid for. Whether you go online or stick with paper statements, you have the power to make a difference. If you see something wrong, report it right away. Now, my last story features Gene Bishop. Gene always made a point of checking his mother's Medicare statement and medical bills. Then one day he got a bill that was really suspicious.
My mother had been in a nursing home, and I got a letter, actually an invoice from a transport company that they had transported my mother to her dialysis treatment from the nursing home, and Medicare hadn't paid all of the bill, and they wanted me to pay the balance. Well, I looked at it and I said, well, I have a real problem, because she was, this bill came in 2003, however, she had passed away in 2000. And so I said, I don't think they did the transport. We investigated and found out that the nursing home had actually given my mother's Medicare number and Social Security number to the transport company, when in fact it was somebody else who was transported. So therefore I got the bill. And when I did get that bill, like I said, we investigated it and we looked into it, and we were able to recover the money back to Medicare, and then they turned around and billed the proper company or the proper patient for the trip.
After the transport company dropped the charges, Gene reported the error to Medicare to make sure that they weren't double billed. And for several years now, Gene has been volunteering time with his local SMP program to teach seniors about Medicare abuse and help them report these types of problems.
Many people worked hard to get what they have to be able to retire, and to see it taken illegally, it really bothers me. I was blessed in my work life, and I had a very good job and did quite well, and therefore I feel like I need to pay back the community for some of the good blessings that I've had in my life. And it just gives me personal satisfaction when I'm able to help somebody actually find some money, if you will, or find a bill that shouldn't be paid. I think the Medicare fraud problem that we have in the United States has led to anywhere from a 10 to an 18% increase in the monthly premiums for Medicare costs for seniors.
The scams make me angry. They put my Medicare benefits in jeopardy and take money out of my pocket. But people like Gene, June, and Rosella give me hope. They've been inspired by their own personal experiences to make a difference in their communities by volunteering with their local SMP program. And you can join with thousands of others in the fight against healthcare fraud by volunteering with your local SMP program. We can all do something to stop the bad guys. No one has to be a victim. Every one of us has the power to make a difference. As long as we remember those three words: protect, detect, and report. To find your local SMP program, call 1-877-808-2468 or visit the SMP locator, www.smpresource.org.